welcome to Eye of the Storm. We're filming on location at the Spanish Community Center in Atlantic City. The Spanish Community Center in Atlantic City is a multi-service community center for mental health counseling, parenting, HIV prevention and education, emergency food pantry, clothing closet, after-school programs with tutoring, and so many resources available for people who don't have. And this is something that's very, very, very special to me because if you have resources, it's very easy to access. You can go to any doctor that you like, you can go to any hospital that you like, but if you don't have those resources or the proper insurance to get those resources, what do you do? And this is what the Spanish Community Center is all about. It's people helping people. And this is something that's very touching to me. So I want to introduce you to the players. Going around is Dr. German. Dr. German has just acquired a $2 million grant, which we're going to talk about. And next would be Dr. Talia Odell, is that right?
Yes.
And then we all know the Sheriff Eric Scheffler. And then we have Dr. George Scott. And then we have our CEO, Linda Munoz. And then, of course,
Arlene.
Munoz. Arlene Munoz. So we're going to talk about all the things that they have going on at the community center, and I'm going to let them describe how they come up with these resources. When people come in, what do they ask for? Is it something that we're all able to do for them? Are there ever situations where people need more than what you have? And where do we send those people? And do you partner up with all those people? So we're going to start with Dr. German. So I understand you just secured a $2 million grant. Can you tell me what that grant is going to be used for?
Yeah, I can actually start out by saying thank you for having me here today. And we started out today by distributing Narcan out into the community. This is the antidote for an opiate overdose. And I think everybody in this table will agree, everybody should have Narcan in their home. It's one of the most important things in your medicine cabinet or your glove box in your car. So this saves lives. So prior to this, so I wanted that to be out there in the community. Myself and the sheriff, we actually put together one of the largest grants for opiate overdose. The sheriff and we've been working together where they have this great mobile unit going out to educate people following an overdose in the community. What we did, partnering with first responders, we were the first medical school, Rowan School of Osteopathic Medicine, where we're going to put medical people on that unit also, specifically doctors in training. And there's reasons for that. Most importantly, to really start out early on in their medical education to take down the stigma of addiction medicine and really realizing that we're partners with the police and fire and everyone else. And that, bridging that together is why I think we got our grant. And it was one of the largest that was ever given to first responders in the nation. And we're right here in New Jersey doing that. So I'm really proud to work with Tim, who's not on camera right now, and of course the sheriff.
So I think all of this is so important. We just had a discussion, at the Lighthouse about Narcan and how to get it and why we don't have it and what do we do. To have this available, I agree with you. I think that we should all be educated on Narcan, considering what's going on out there. I know Tim, the sheriff, and myself, we see this constantly with overdoses, and how do we help? How do we educate? How do we get people the resources that they need to revive somebody? And it just seems like such a thing that we should always have, to revive somebody, right? We're going to watch somebody OD and not have the resources to revive. By the time we get a hold of, and the police will show up, and they're very responsive all the time, but it might be too late. We need to be on the spot, ready to care for those that are struggling. So,
especially with the drugs on the street right now, fentanyl is, you have to act quickly. Having this very close by at an overdose is critical. It really means saving their life.
When we first started at Lighthouse, when we acquired Lighthouse Recovery Centers of America, we were getting people coming in just on fentanyl. And at that time, there was no test for straight fentanyl. So I'm in the admissions department, and I'm also a patient advocate at the time. And I'm wondering, how do we not know when someone's coming in on fentanyl? They're coming up not positive for opiates. what do we do? How do we help them? And for a while, we were fighting with the insurance companies to give us something that will test for fentanyl. And all of a sudden, all these tests started to come out. Too many people are overdosing, and we all don't have the resources we need. And that's something that I'm very passionate about giving people what they need. And like I said earlier, if you have, it's very easy to access. But what happens when you don't have? So, Arlene, I'm going to let you kind of go through our services and point to the people that have involvement, and we're going to talk about that. Is that okay?
Sure.
So Arlene is a very, very dynamic person, and you know, I'm very happy that I met you. And when I spoke to you on the phone last night, I knew inside that I was talking to the right person, because I'm a person of, and people make fun of me at the lighthouse. I'm a man of the people. They call me the mayor in the lighthouse. I will do anything, answer the phone for anybody. It doesn't matter what time it is. I'll give up my weekends, because the sheriff and I have done that before, because it's about God guiding us to help others, right? And we all become soldiers of God, and there's no no's anymore. And when people ask me, do you want to be in the field that I'm in? And I would say, how much you got? Like, what do you have inside? Because you're going to need it all. So Arlene, tell me.
Well, one of the things, I guess, when the agency started back in 1970, it was founded by Lydia Munoz, who is still our CEO, and to my right. It was really about service and advocacy for clients. And why don't I share and have Lydia?
I just realized that I pronounced your name wrong, and I
That's
apologize.
Okay, call me Linda, I know I'm beautiful.
Linda is beautiful in
So
Spanish.
so
Linda.
Lydia is also a very dynamic person, and she's my people. She's from New York, and you know, we were just talking in the back, and we were talking about traffic and how people respond to others when they're rude. And she gave me a little something, which I'm not going to say on camera. My whole face turned red because I thought I was right back at home again when she told me how she would tell someone where they got to go. Right?
You're turning red as you
Yeah,
speak
because
of me.
you're a real person.
I'm dressed in pink, not red, okay?
So you're a real person, and I appreciate you being the way that you are, because no faking this.
Well, this is why when we started back in the 70s, back then, being a Latino, being a minority twice, being Latina and Hispanic female, I was not welcome many, many places. But being from New York, we know how to open doors when doors close in our
just kick them
faces. So what we did, I became the voice of the community for the whole county. I was young and perhaps not too bright, because I probably should have been working someplace else, but the love was for the community. I started working with the migrant population back in the 70s, and I knew that I wanted to do this. And I'm still doing it, although I'm past retirement age. I love what I do. When you can make an impact on a person and also bring families together that have been separated by the system, and you're able to do reunification with families, be the voice of the community that are not able to speak for themselves, then I feel that, like you were saying, I've been blessed, and God gave me the call to be the voice of the community, and I think I will be doing that until the very end.
So let me ask you something, Lydia. The voice that you got, the calling, do you remember it? Do you remember when it happened? Because I remember when it happened to me.
Oh, it happened to me young. Having been in New York, I had to translate for my mother whenever she went, and I knew that I wanted to do that. My mom used to work in a factory, therefore I knew that's the type of job I would never want. So you gave yourself an education so you could be, so I decided back then that I knew the injustice that was happening back in the days, and then I moved to New Jersey, and there's more injustice done.
Absolutely.
So I knew that that's what I wanted to do for the rest of my life.
So it's funny, I used to walk through Manhattan, and I would see so many people that didn't have a place to be, didn't have any food, and some of the people that were in the homeless end, some of it was to make money. We always have people that are using the sympathy card, but for me, I never judged why you were there. Because I believe that when you give from your heart, and no matter where that resource goes, you gave for the right reason. So I would spend a lot of my time going around, going broke, helping the homeless. And, my friends who have a lot more than I do would say, Marlon, I don't understand. I said, I can't say no anymore. and I'm not sure when it happened, but I just can't say no. So the person that started our company, Recovery Centers of America, one of the senior partners there, is my friend. We all have a friend that made it, you know, and this guy gives everything he has away. And I asked him, what are you doing? Why are you giving all your money away? He says, I have what I need, but there are people that don't have what they need. And I'm going to give you an opportunity to go somewhere else to use your heart. And he sent me to meet the owner of Recovery Centers of America. And I remember when I didn't know if it was an interview, I didn't know what was going to happen to me. And he said, so tell me, what are you going to do for us? And I said, whatever God tells me. And I just got an email telling me to come in. And for me, I can't do anything else. And I think that's where we all feel around this table. So,
Or
If I
one-
could say though, you know, when Lydia founded this organization, probably over 40 years ago, like she said, it was just designed to provide service to those in need within the community. And then in 1999, they had the addition of Shore AHEC, okay, and that changed the focus from not just providing for those in need, but also meeting the healthcare needs of those individuals and within the community. And then we partnered, the Rowan University School of Osteopathic Medicine, through Shore AHEC, partnered, and that allows us to then provide screening services and medical services to those people in need.
that are to a vulnerable population that's very, very much underserved and
Yes.
underrepresented. I think one of the things that Dr. German mentioned was access. And access, whether it's Narcan, with this partnership, one of the things that we were very excited at Shore AHEC, because we have great leadership under Dr. Odell and Dr. Scott that honestly had service in their hearts and service and commitment in their hearts, and wanted to give back. And this process, and even today's event, it is a successful event for me because I see so many people getting screened for blood pressure, for cholesterol, for people that didn't have money for a flu shot. That quite honestly, that $40 may be the difference between food on the plate,
Yes.
which goes into the social determinants of health and everything that we're doing, or not. So it is really through the partnership and vision of Dr. Odell, Dr. Scott, and Lydia, and you had said we all come home, and this center is home and family to not only myself, but to many people in the community. I am no one. And our family today has gotten bigger. We
Yes.
had, we're so excited about this partnership with Hope One, and the sheriff and Tim Reed has been unbelievable. And Dr. German, and the school and the students, they talk about millennials, how maybe they may be in a different place, but we saw millennials today giving back and learning and teaching and wanting to be involved and learned. And the fact that they're so enthusiastic, and we have a community that has need. All we did was pair a bunch of people together. So this informal yet formal collaborative that we have here, really, I want to thank you, but I need to thank everybody that's here.
Of course.
But at the same time, I have to say the Spanish Community Center has a committed staff, okay?
Absolutely.
That are really community focused and interested in providing care to those in need. And they confront challenges every day, and they seek the resources that they can advocate for people in this community.
I speak to the sheriff about this quite often, that it's the criteria to do this kind of work, right? And at Recovery Centers of America, the first questions they ask you are, do you have a heart for the patient? We understand you have a master's degree. Are you going to look at your degree, or are you going to serve the patient? And I've actually seen some therapists that won't get up out of their chair. And to me, not serving the patient is a crime. The patient comes to us for help, and we're supposed to answer the call. And I spoke to the sheriff and says, you know, my guys have the same thing. They need to serve. They need to have a feeling for the community, because when we call, we want not only you to show up, but not to be afraid of you, right? So we're going to come right back, and I want to talk to the sheriff, and I also want to talk to Dr. Talia about things that you're doing out there and the partnerships that we're creating together. And I could tell you, I'm very appreciative of the partnership I have with Hope On. There's nothing that I won't do for what you need, and I feel the same way from you.
Absolutely.
So
we appreciate the partnership we have with RCA as well.
I think that we all have the same goals, right?
Yeah,
It's
absolutely.
people helping people.
Very like-minded, so.
Yes. So don't go away. We're going to come right back. Welcome back to Eye of the Storm. We're filming at the Spanish Community Center in Atlantic City. And our next topic is the students that actually come through here. So Dr. Talley, you want to talk about the success that they've had?
Sure. So I'm the former director for New Jersey AHEC and now the health advisor, chair, and board member at the Spanish Community Center. Part of AHEC. So AHEC is a program that's funded through Congress to recruit people from underserved communities, train them in some medical field, and return to those communities to serve. So last year, a part of our grant required for us to build a scholars program. And the students that were here today are actually our pilot students. We collaborated with 5 different colleges and universities along with the School of Osteopathic Medicine to build the program. We needed to have 40 clinical hours, 40 didactic hours to be done in the community. So the first year were just lectures, but my vision was to be able to teach them, assess your community, find out what you need there, and once you're able to do your needs assessment, go back into those communities and actually provide the care that is needed. So those students were here today as part of that program, and it was nice to kind of see the process and for them to be involved. As Arlene said, you think millennials and you have a certain idea, but we were lucky enough to be able to have the students. We kind of handpicked them from these 5 different colleges because it was a new program, and we told them we have a pilot program. It's you're pretty much going to be the guinea pig, but we're looking for someone that is interested in going to find out what's needed in our communities and actually do it, build a research project around it, and have it done. So,
it's very infectious when you get into the care business, and as I spoke about earlier, it's something that you almost can't stop. It becomes ingrained in you, and then everybody that has a similar heart, you almost try to recruit, because we need all the people we can get.
yes.
The owner of my company would always say, I need an army. Are you guys ready to sign up? Because when we have meetings in corporate, this is a man who has more than he'll ever need, and his family and their family never has to do much. He's the first one in the office, last one to leave. And he would always say, Marlon, what else are you doing out there? People are dying, people need resources. Are you there to help? Do you answer the call? So when I hear you have millennials that are actually stepping up,
They are answering the
Yes.
call.
because I try to get my nephew all the time, like, hey, instead of a video game, come see what I do, and I did it with him for about 6 months already. He called me last weekend and said, I picked a major. I'm gonna be a therapist. I'm not sure what kind of therapist I want. Picked a school, and he said, Uncle Marlon, can I work with you? And I said, be careful what you ask for. Because when you ask me to come over and I'm always working, this is going to be who you are. If I can help the way you do, I want to do it. So I think we lead by example.
Yes, and I think it's contagious.
And Lydia, I think you've led by example by showing that it's possible. That if you want something and the resources are there for you and you try hard, you can get where you're going to go. Tell me.
It is so true. At our agency, we have people who came here when they were doing college and then they ended up getting hired. Not only that, but the fact that I think in education there's power. So what we do is, I'm also a field instructor for Stockton and Rutgers University. I try to recruit people into the master's program, and I let them know that they're not paying me for me to recruit you. But I think if we train the young people to be therapists in the future, because there is a dying need for bilingual therapists. It's so interesting. My granddaughter is only 7, and she asked me the question. She goes, "Grandma, how long have you worked here?" And I said to her, "Well, I have been here longer than your mother has been on this earth." And she said to me, "Mama, I think I want to do the same thing you're doing. When you die, I want to work here, but I'll be sad." And it's interesting with the medical students that come through the agency, she got exposed to the medical students as well. She's changing majors right now. She wants now to be a doctor. So, which I think is nice, because by exposing the young people to how much they could go in life. And I also remind them that you have to give back to the community. You've been blessed with so much, but you also have to give back to the community. And I'm firmly believe in that, whether you're in education and social services, whatever the field that you choose, do it from your heart. And try to make a difference in a person's life. And it's wonderful when we have people that I have been able to reunite their families together who they don't need the services. They just come to say hi and to tell me they're praying for me, which is wonderful. So it's really great when you have families that thank you for what you have done for them. And again, you don't have to let them know your education. I never tell them what I have, I don't have. It's what you do for them. And if you can make a difference, then I think it's wonderful to do that. And I will continue to do that until the end.
I have to tell you, I commend your commitment. And I look around the table and I see where the commitment is. It's everybody. I think that you've developed a nice circle here, and other people are looking to chime in to help. That means that the message is being sent that it's okay to help, it's good to help. What else can you do? And I felt it as soon as I walked in here, that people were being served. And I appreciate your commitment, because we're all part of the same energy. And we need to feed that energy, and it's about people helping people. And I think that if we continue with that mindset, we'll make the day a little bit better for somebody else. So I know that you have to step away. So the CEO has got to serve patients outside, so she's going to need to step away. But we're going to come right back, and I want to talk to the sheriff, because I want to know where this connection came from. And I want everybody to know that the sheriff, Eric and Tim Reed and Hope One, will go everywhere to help. It's just,
Yes.
I see the van, and what are they doing now? What are they doing now, And it's interesting to me, because I know wherever they are, someone's getting help.
And I thank you for joining us. This is an annual event that we do. Please join us again. And it's really nice to now be able to serve the community even better, because our linkage is growing. So I thank you all for being here. All right,
I
and
appreciate
mi casa es su casa, as we say in Spanish. Okay, my home is your
So
home.
we're going to invite you to the lighthouse, and we're going to have another talk, and I'd like you to meet our CEO and our executive director, and I want you to see the hearts that we have, because this is who we are. We're the same as you, So we're going to come back right back. I'm going to talk to the sheriff about all the connections that he's making out there, and just the good that's being done. Don't go away. We'll be right back. back to Eye of the Storm. My name is Marlon, and we're filming on location at the Spanish Community Center. And we're talking about resources for people that don't have access to them. Something that's very, very special to me because, like we were all talking about, if you have the resource, you probably would never see the inside of this place, you know. And around this table, we have professionals that have their own careers that give their time because it's so important to give back. I was just talking to Dr. German about treatment, and how many times do you admit a patient when they've either eloped from treatment, whether they are not ready, they won't commit themselves, they come in and out, and we both looked at each other and we said, as many times as necessary, right? And I know, Eric, you have the same philosophy that if you stay one more day or one more hour, it's a success.
Absolutely.
Right? So at Recovery Centers of America, we partner with the Sheriff's Department, with the Police Department, with EMS, because we feel it's so important to have our local government with us. We need you guys. I mean, there are so many things that we can't do by ourselves, you know, and you kind of been able to move mountains with what you're doing, and the Hope Barn Project is just such an unbelievable idea. And
Yeah.
look at what you've done.
Yeah, it really is incredible, and it's definitely a delivery of passion. I mean, it's something that, like many families, addiction, mental health has touched my family personally, and it's not a secret. And I've told my story many times, but it not only touched my personal family, but it's also touched my law enforcement family, and I've seen it, you know, for decades, being involved in law enforcement. And one of the things I've been struggling to be able to make it easier to connect to treatment than it is. And we were talking, Dr. Jeremy and I were talking earlier as well, is that there's more treatment, more accessibility to treatment in New Jersey than there's ever been in the history of our time. Unfortunately, it's still very difficult to connect to it. And what my people in the Hope One Project are is experts at connecting to it. We have over 42 people, groups, in our coalition of partners. And we use every single one of them. RCA is absolutely one of them as well. Rowan College is now a partner of ours, and we're growing a partnership with Hispanic
Spanish Community Center.
Community Center. Thank you. And that coalition, that partnerships is what makes us so successful. We're the most prolific treatment connector in the state. And we put over 430 people into treatment in the past 13 months, right off the streets of Atlantic County. And that's because we go find them. We plant our flag in the hardest hit areas, where we look at the opioid overdose map, we look at the arrest maps, we look at sales where the highest drug sales are, and we actually plant our flags in those areas. We encourage people to come forward.
Let me ask you a question. So you're out in the Hope One van, and you have people that you know need services, right? But they're afraid. And they come to you and say, you know, I would like to get some help, but I can't get any help. There's really no hope for me, you know, because I've heard this a million times, that patients will say, listen, I'm not worth it. They're not going to give me insurance. Then no one's going to accept me into treatment. And that breaks my heart. Because if someone doesn't think of themselves as a person who deserves, we're all the same. We all deserve that kind of a resource.
We're all worth it. There's no
all
doubt
worth
about it.
it. Right.
And those barriers to treatment I've heard many, many times. And so one of the things I've created was removing those barriers. So it's not uncommon for someone to come up because we put out coffee and donuts, and we're trying to attract people to us, honestly. There's no uniforms out there. They're all in plain clothes. We want people to come forward, and when we first came out, they thought it was a trap. The sheriff's office is doing this. They're going to arrest us as we come forward. Well, now, 13 months later, they come and find us because they know that's not true. We're connecting people. But they would still come up and say, hey, you know what, I'm really interested in treatment. I really want to go, but I have no insurance. Oh, you have no insurance? That's okay, because we're going to get your presumption of eligibility Medicaid in 10 minutes.
Right.
What? Oh, yeah. Well, no one's going to take me because I'm a certain age, I'm a certain sex, I have dual diagnosis, I use heroin and, you know, Oxycontins, and I use, you know, I'm on fentanyl, and I have, you know, every other drug, you know, too many drugs to mention. Oh, really? Well, we have a provider who absolutely takes exactly who you are. Oh, well, they're not going to have any beds. Well, I have the provider on the phone right now, and they're willing to accept you. And they want to do an intake with you right here. What? Yeah, intake right here. They do the intake. Oh, okay, well, they say I have to be there at 2 and I have no way of getting there. Oh, you have no way of getting there? Don't worry, the sheriff's going to transport you. Oh, well, I have no ID to prove who I am. Well, that's interesting because the sheriff created an emergency ID program that as long as we have verification of treatment and we can identify you in some way, either through a friend or through maybe being incarcerated or something, he'll grant you ID in 3 minutes. And we'll, 28-day program, we're going to get you. Oh, well, I have a warrant. I have an active warrant. Oh, you have an active warrant? Oh, that's interesting too, because the sheriff has a partnership with the Superior Court system, state probation, as well as municipal court. And again, if we have verification of treatment, we'll get that remanded for you.
So a lot of excuses not to get help, right? So those excuses are a little more serious than the ones that we hear. So they'll come into the lobby. I gotta walk my dog. I can't stay here. No one is there to feed my cat.
Right.
What am I gonna do? And I would look at them and say, well, let's make some phone calls and try to get your stuff taken care of, right? But now we have the sheriff's department with the Hope One saying that even if you have a warrant, even if you have all these barriers in front of you, we're gonna take care of that for you.
Right.
You know, it's
And it's interesting. I want the Hispanic community to also realize this: is you come up to us, we're not asking you if you're legal or if you're illegal or you're national. I don't ask anyone that. I'm not going to see a Hispanic person and ask them that. I don't have a right to do that. The law doesn't allow me to do that, believe it or not. You're there for treatment. We're there to provide that treatment. And I also want people to know that they're suffering and they may, be in a situation where someone may OD in front of them. I want them not to be afraid to be able to call, emergency response, EMS or police. Well, they're both going to respond to it, honestly, and that's the truth. But there's laws that protect you as a caller. You will not be arrested. You cannot be arrested. Even if you had drugs sitting in your hand as the officers were coming
Can you say that again?
Yeah, you will not be arrested. You call for help for someone, and you're at the scene. You stay with that person. You will not. And if you call for help for yourself, you think, "Oh my God, something's going wrong. I'm not feeling right. This is not normal." You will not be arrested, even if you're found with drugs on you.
So I asked
there's
you to
laws that
repeat.
protect you.
I asked you to repeat because we've talked about the trust that people have in people in uniform.
Right.
And when you're used to doing wrong for so long, the uniform is scary.
It absolutely is.
And nowadays we're saying, hey, the uniform is for you to run to me,
Right.
because I'm here to help you.
Right.
And that's something that we didn't have before. So what you're doing is breaking the stigma of people's assumption of the law. And so in New York, I'm not sitting with the sheriff. I'm not sitting with a mayor. I'm not going to sit with a councilman. It's too hard to get to. Here in New Jersey, or wherever I am, I know the mayor. I know the sheriff.
You have my personal cell,
Yeah,
right?
and I can call you on Saturday.
You do call me on Saturdays.
Yeah, well,
We work on
because I need
projects.
you, right? So and
Maria's not that happy about it, but I spend all day with you, so.
It's one of those things. The sheriff and I were working with a patient, and we offered a scholarship, and it didn't matter how many hours it took to get this to happen, because we joked about it. Ooh, it took 6 hours on Saturday.
Yeah.
Someone's really pissed off in the house, right?
Yeah.
So, but it's about being a soldier of God. and
She's very
being-
supportive. She's an
Yeah.
angel, honestly.
And you got to
I'm
be
lucky
ready
to have
for the
her.
call.
Yeah.
Can we say too about people with pre-existing warrants, that sometimes are afraid to engage law enforcement. In addition, we were talking earlier about undocumented people. That they too should have no fear of coming or calling law.
Absolutely not. There's laws that protect you in the state of New Jersey, and that didn't happen last week or last year, but for the last 3 decades, laws are in place in New Jersey. If you're a victim of a crime, if you're a witness of a crime, your nationality or your documentation will not be questioned. It's illegal for us to do that. Please do not be afraid. We are here to support you. We are
Can you
here
say
to
that
help
again?
you.
Yes. Say
I
it.
think it's important to say it again because people
Absolutely.
there is help and you don't have to get picked up on a warrant if you have an issue. You can go find the Hope One van
Absolutely.
and get all of the help that you need,
Absolutely.
including the warrant for
Remanded.
and an ID, which when someone, if they should have an issue, would be important. especially if documentation status
And
was an issue.
I want you to realize that we don't ask you about we don't run anyone for a warrant. That's not my purpose. That's not what they're doing out there. You don't come up to hey, I'm John Doe and I need help. Okay, give me your social, let me run you for that never occurs. However, if you tell me or tell one of our people, they're compelled at that point, because we are constitutional officers and we are officers of court. We can't overlook that. But we have a process in place, and the court. It's not just me wanting to do it. The court wants to do it. The court realizes that treatment is much more successful than incarceration, and that's what we're here to do. And it's a partnership. It's another partnership. It's why we're successful.
And it's a partnership that we all need. I mean, there are so many people that don't have and so many people that are afraid. I look online all the time in the middle of the night to get the patient's opinions, how we did with them, and the reports that the patients give hope to someone who's looking for treatment. And I think now that people know that they don't have insurance, they're maybe undocumented, and they could find the Hope One van. So if they can't find the Hope One van, how do they find you?
Well, so what I did was I realized how important Hope One really became, and we do go out regularly, several times a week, and we post it, and we have a newsletter, and we're going to work with you to make sure that it's actually translated into Spanish and gets out to the community. But you can call our number. You can call the sheriff's office. We have 24-hour dispatch. And you can basically tell them that you're looking for Hope One and you need to connect. They'll do an intake over the phone, and in the AM, someone from the Hope One Project will contact you personally. Now, of course, if it's an emergency medical issue, you need to call 911 and make sure that's addressed. But if it's something that can, wait, or if it's during the day, one of my people from the Hope One Project will call you directly and make an appointment with you.
So you're saying that they can call the sheriff's department directly, not be investigated for who they are, and just say, hey, I have a problem, I need help, can you help me?
Absolutely.
And you can find them on social media too.
Yeah.
Facebook,
Yes,
which they list everything where they're at.
Yeah, Hope One, AC.
Arlene knows everything.
And there goes another reference to my Tim Reed, because he does an incredible job getting our word out about
Yes,
Hope
he
One.
does.
He does.
Well, it's the collaboration and sharing the word.
Absolutely.
But I think the medical community, the physician community, also are part of what stigmatized this disease. I don't think people in the community, substance users, think doctors are necessarily someone that they could run to or trust, but that would be free of stigma. Sure. In fact, they're right. So this is one of the reasons that we put doctors in training on this van, so that people in the community can say, wow, that doctor cares about me.
Yeah.
And to be honest, part of the opioid crisis, because doctors walked away from it, I'm owning that as we walk back into it, and we have to own that, and we have to train the next generation of doctors to be stigma-free, to walk hand in hand with their partners in the big need communities that we have, because the deaths of this disease just keep going up. So that's why we're so happy to work with our partners here and be here today in this community, because every time people see us all together, it'll start sinking in that we're actually there on their team.
Our partnership with Rowan for that $2 million grant is about training, educating, and giving out Narcan. But part of that, and we're doing public safety as well as corporate partners as well, police, fire, EMS, private security, corporate partners. A large part, and Rowan is developing this as part of the grant, is going to be training on stigma, because there's stigma in that community as well. There's stigma across that community. They don't understand addiction. They don't understand that it is as much as a mental health crisis as anything else. And people have to understand that. I mean, it's funny because you look around a table a lot of times, and it's so much out there in the public, and a lot of people say, yeah, I understand this, I understand that, but there's still a tremendous amount of stigma of what addiction really is, and it affects every single person. And until it affects your family personally, listen, I'll be the first one to admit it. We want to be completely transparent. I'm a career law enforcement person. 16 years ago, my oldest daughter, I have 5 daughters, 1 son, I don't want to leave him out, he'll be upset. Went into active addiction, and she stayed in active addiction for over 15 years ago. And if you were talking to Eric Scheffler, a Atlantic City police officer 15 years ago, about addiction, you'd have a different person.
Right.
Because my view of what an addict looked like, what treatment looked like, what recovery looked like, was nowhere near the person that's sitting here at this table. I experienced it firsthand. It's much different.
And not only
and the
are you
reason-
experiencing it, it's a lot of other people who
Yeah.
never thought they would.
Absolutely.
You know-
And the reason why that Hope One exists is because of my daughter.
I think one of the things that kind of rings with this is the fact that you have people that are committed, and the traditional services, the way that they were done, were no longer okay.
Yeah.
They thought out of the box in order to reach individuals and are going into the community, you know, and again, the collaborative here, but Rowan, and Rowan SOM in particular, you know, one of the things when the cultural competency bill was signed in the state of New Jersey, it was signed Rowan SOM because we wanted our students to learn firsthand and to be paired up with organizations like ours. People see Spanish Community Center and I'm not Spanish. Well, all are welcome. You know, all are welcome, and you never know what you may find inside.
right.
And it's just the creativity. You know, if you have the same problem 10 years in, then you've got to look at the people that are doing the work because they're not doing something right.
Absolutely.
You know, and the fact that 14 months young is Hope One, that gives hope to other people and hope to organizations, and has uniquely been able to get all of these partners with our the student doctors training. As Dr. Germain had said, when you're in here, people, this is where they get to make the mistakes in their formal training.
Yeah.
Now, we don't like them to make mistakes, and they don't often, let me just say that, but this is an opportunity that we have our community health workers working with social work, with parenting education, with medicine, with health, and with police,
Absolutely.
all coming together. And it's, as he had said with everything else, if they need food, because we know it's a major, if you don't have food in your belly, you can't make good decisions.
How about
So we
someplace
get
to
them
live?
food, we
Place to
have.
live, right.
Yes, yes.
So Hope,
And what we say is, you know, much the same as the Spanish Community Center says, you don't have to be Spanish to come here. I mean,
No.
you know, and just like addiction is not specifically a Hispanic disease, a disease
Doesn't
of
discriminate.
African American, doesn't discriminate, rich, poor, old, young, you know, and you see them all the time. And the impact that it's had, you know, nothing was really done until it reached this crisis level that we're seeing.
So, you know, we all search for these partnerships to serve others. Recovery Centers of America just made a partnership with Wawa. There were so many people overdosing in the bathrooms and in the parking lots, and some of our people have been there to answer the call in Narcan and then called the authorities to get them to a hospital. And we asked them, what can we do to help you? How do we serve you? And they were it just went the opposite way. They said, no, how do we serve you? And there are sober livings that we refer our patients to that they give the food because they can't afford it. So they have to do something with the food, and sometimes you can't donate food unless you're a approved provider. I had that problem in New York when I had a bagel store, and they deliver the food right to these sober living homes. They have such a need for their staff that's also struggling. And, you know, it's hard to step forward and say, hey, I have a problem. Please don't fire me. You know, and now it's changing where you're able to come forward. And Recovery Centers of America looks for these partnerships because before money is made, life has to be saved. You know, and it's about us getting in front of people and saying, hey, I know you're struggling, let us help you. Let us get you some counseling, let's get you some family therapy. It's a family disease, everybody deserves counseling, and we all have to step forward. I'm very comfortable in this room because I feel that this is where this room is. And I want to thank all of you for participating today because people need to see this, and I want you to know it is a directive in our call center to hire bilingual, because I know that when people call and you're not speaking their language, they get scared and they're gonna hang up, so, I wanna close with, if anybody is struggling out there and they don't know what to do, you see that there's resources around this table. You see the sheriff is at this table saying, hey, it's okay, you can come forward, and you can call us 24 hours a day, and if you have someone that's struggling, we want you to step forward, because this is no way to live, and we're here for you. So I'll say it again, we're open 24 hours a day, and if you need us, you dial 1-800-RECOVERY, and somebody will answer that call. Whether you can come to our program or not, we will place you somewhere. No one has left out standing. So, again, I want to thank everybody for coming, because I think that this is something we should continue, and I want to go on record saying I'd like to invite all of you to the White House to continue this discussion. And when you meet our therapists, so we have a counselor who's in charge of the HEAT program, the human trafficking. Her name is Joni, and we introduced this to our staff, and they have bought baskets. They rallied behind this group, gone to every fundraiser, and I'm sure this is what's going to happen here. We have a bunch of people who just want to show their heart. So I want to thank you again, and
Thank you.
there will be another scene, and Arlene, thank you so much.
Thank you, our doors are
Thank you so
open.
much. I hope you guys enjoyed the show today. This is about real people helping people who don't have resources. So you saw the resources at the table. We have a 1-800-RECOVERY number. We're open 24 hours a day, and you can call the sheriff's department, and the sheriff will connect you. If you feel that this is not a call you want to make to us, you want to make to the sheriff, it doesn't matter who you call as long as you call somebody. So everybody out there, keep your loved ones close and don't ignore the signs, and make that phone call. Thank you for watching.